Welcome to This Explainer. Today, we're going to completely demystify that incredibly complex biological link between the everyday stress you're feeling and your high blood pressure. And honestly, by the end of our time together, we're going to build you a highly effective, strictly science-backed toolkit for some real tangible relief.
So, picture this. You're sitting in a doctor's office, you're already worried about a high blood pressure reading, and someone tells you to just relax. Have you ever been there? It is so incredibly frustrating, right? Well, I want to validate your experience right here, right now. Stress is not just in your head. It's a very real, measurable, and highly physical reaction that's happening deep inside your cardiovascular system. To show you exactly how this whole thing works, here is our roadmap for today. We'll cover stress and your heart, the biology of stress, acute versus chronic stress, the science of relaxation, and wrap up with your stress management tools. Let's jump in. All right, Section 1, stress and your heart. Let's look at the impact on the body. Okay, the foundation of this entire explainer really rests on this one core concept, homeostasis. Imagine homeostasis as a perfectly balanced scale. It's your body's optimal, comfortable, stable state where everything is just humming along, functioning exactly as it should. Stress, then, is literally any challenge or threat that tips that scale. It requires your body to scramble, adapt, and adjust to find that center of balance all over again. Now, you might be thinking, isn't all stress bad? Well, actually, no, that's a huge myth. We have to differentiate our terms here. Eustress is actually good, healthy stress. Think of these as mild challenges that act like a workout for your system, strengthening your homeostatic resilience and promoting your overall health. But on the other side of the coin, we have distress and stress. Distress is that overwhelming bad stress we all dread, and stress is this weird, inadequate level of stress where you're basically under-challenged. Both distress and stress disrupt your normal bodily functions. They completely compromise your balance, and over time, they just wear you down. Moving right along to Section 2, the biology of stress. Let's look inside the body. When you encounter a stressor, a rapid-fire chain reaction goes off inside you. First, a threat is detected by your brain, specifically the amygdala. Boom! This instantly triggers your HPA axis and your sympathetic nervous system. Step 2, a massive flood of stress hormones. We're talking cortisol and adrenaline is dumped directly into your bloodstream. Step 3, reacting to these hormones, your blood vessels physically squeeze tight and constrict, which instantly raises the pressure inside them. And step 4, your heart rate spikes. This is the classic fight or flight response kicking into high gear. Biologically, your body thinks it needs to battle a predator or run for its life. And here is a super fascinating curveball for you. Evolution has actually shaped differences in how our bodies chemically react to these threats, and it varies by gender. Research shows that men generally exhibit a higher sympatho-adrenal reactivity. That means leaning heavily into that intense, immediate fight-or-flight response we just talked about. Women, on the other hand, often display a stress response that is buffered by the hormone oxytocin. This promotes attachment, caregiving, and seeking social support to bring the stress down. It's a brilliant illustration of how totally different human biology can be when faced with the exact same pressure. Let's move to Section 3, acute versus chronic stress, understanding the threat. We absolutely must draw a sharp line here between normal, short-term stress and chronic, maladaptive stress. Acute stress, that's that short-term fight-or-flight reaction. Like, say you narrowly avoid a car accident. Your blood pressure shoots through the roof, but once the danger passes, you calm down and your blood pressure returns to its pre-stress baseline. No harm done. Chronic stress, however, that's a whole different beast. It is a long-term, cumulative physiological burden. It happens when your body stays stuck in go mode, maybe because of constant financial strain, unrelenting work deadlines, or heavy caregiving duties. Over time, this constant, unyielding activation literally wears down the elasticity of your blood vessels, and that is what leads to long-term cardiovascular risks. The physical toll of this chronic stress is just intense. Your poor body is subjected to sustained high cortisol exposure. You experience increased inflammatory activity. We're talking dangerous spikes in these internal biological alarms with complex names like IL-6, TNF-alpha, and CRP. You can literally lose your natural sleep-wake cycle, your circadian rhythm. Furthermore, your body develops this heightened sensitivity to angiotensin II, which basically locks you into sustained hypertension. So essentially, being stuck in this chronic stress loop causes persistent inflammation and high blood pressure, and it completely overrides even your most positive healthy habits. Which brings us to Section 4, the science of relaxation, finding balance. Allow me to introduce the hero of our story, the parasympathetic nervous system. Think of it this way. If the sympathetic nervous system is the gas pedal, the parasympathetic system is the brakes. It is the crucial physiological weight that brings our homeostasis scale perfectly back to the center. When you activate this system, it purposefully slows your heart rate down. It relaxes and opens up those tight, constricted blood vessels. And it finally promotes a state where your body can start to heal. Check out the hard data mapped out on this chart. A massive meta-analysis published in PubMed actually tracked patients participating in a mindfulness-based stress reduction or MBSR program. The results? Totally measurable and undeniable. Participants saw an average drop in their systolic blood pressure of 6.64 millimeters of mercury and a diastolic drop of 2.47. That's huge. And beyond those incredible cardiovascular benefits, the relaxation program also significantly reduced their symptoms of depression and anxiety.
Finally, we are at Section 5, Stress Management Tools. Let's get into the actionable solutions. One of the absolute best tools you can have in your back pocket is the 4-7-8 breathing technique. I seriously want you to try this later today. It's simple. You inhale quietly through your nose for 4 counts, you hold that breath for 7 counts, and then you exhale completely, making a whoosh sound through your mouth for 8 counts. Why does this actually work? Well, that long, extended 8-count exhale is the exact biological trigger that signals to your brain that you are safe. It forcefully activates that parasympathetic nervous system to relax your blood vessels. Another incredibly practical, everyday tool is the STOP technique. Step 1, just stop what you're doing. Step 2, take a deep breath. Step 3, observe your physical, emotional, and mental feelings without judgment. And step 4, proceed with intention. This method is an amazing way to just interrupt your automatic chronic stress patterns. It gives your brain, specifically that screaming alarm bell amygdala we talked about earlier, a much-needed moment to step back and regulate before you just react on autopilot. Now, beyond those quick, in-the-moment techniques, your foundational daily lifestyle habits are absolutely essential for building true cardiovascular resilience. Major organizations like the American Heart Association really emphasize this stuff. Prioritize getting at least 7 hours of sleep. Engage in gentle movement like yoga or just taking a walk. This literally helps your body metabolize those circulating stress hormones. Try to limit alcohol and caffeine because those can actually mimic stress responses in your body. And please, connect with your friends and family. Supportive social relationships foster personal growth, and they biologically buffer you against stress. Now, I know you might be looking at this toolkit and thinking, I just don't have the time for this. But guess what? The research shows that just 10 to 20 minutes a day of these consistent relaxation techniques is enough to start seeing a noticeable, sustained drop in your blood pressure over time. It's not about being perfect. It's just about sending your body small, consistent signals of safety. So, I want to wrap up this explainer by leaving you with a direct challenge. What is one tiny, simple relaxation cue you can build into your routine today? Maybe it's doing that 4-7-8 breathing technique while you wait for your morning coffee or tea to brew. Or maybe it's keeping a smooth stone in your pocket to remind you to use the STOP method when you touch it. Reducing your blood pressure isn't just about medications or cutting things out of your life. It is profoundly about the intentional moments of calm you choose to build into it. So how will you retrain your nervous system today?